Now, patient safety strategies to mitigate malpractice, litigation and clinical negligence are just some of the topics being covered at the 11th Quality Management and Patient Safety Conference. For more on this, I'm joined now by Jacqui Stewart, who will chair the conference. Jacqui, very good afternoon to you. Thank you so much for your time. Before we get to the crux of some of the conversations that you'll escalate at the conference, we're learning more and more how staff and patients are being attacked in hospitals across the country, some even killed. It's a very disturbing pattern. What is your reaction to this, especially after learning of the incident that occurred in Mpumalanga?
I think it's just unacceptable, Mpho. People working in hospitals, healthcare workers, security guards, anybody working in a hospital should be safe, because they're there to serve the public, and that's what they do day in and day out. And I think it is just unacceptable and tragic that we are losing workers in hospitals for these violent attacks.
In a few days' time, as you prepare to host the 11th Quality Management and Patient Safety Conference, in light of the increase of attacks across hospitals, what topics will the various panels seek to address?
We've got 3 sessions during the conference. The first one is looking at where have we come from in terms of quality and safety over the years, what have we learnt, and 2 very eminent speakers talking about large-scale improvements that they've made that demonstrate there is some resilience. And then our middle section is specifically about patient safety. Again, 3 very good speakers. One of them, Professor Ethelwyn Stellenberg, is an eminent researcher in patient safety, and she also chairs the South African Medical Legal Association. So she's very well versed on patient safety and the implications, the medical legal implications thereof. And then our final session is, again, quality and safety, because you can't really separate the two. If you don't have good quality service, it's not going to be safe, and vice versa. And they will be talking about real life people who've implemented quality and safety programs in their facilities and telling us how they've done it and how they're making it sustainable.
In looking at the story that I made reference to at the start of our conversation, the group of armed men who held up staff and patients at the Carolina Provincial Hospital in Mpumalanga, some safety measures have been have included an agreement reached with police to now start conducting visible patrolling at the hospital. That's according to the MEC there. What does this now tell us about the multi-million rand security measures already in place to protect both personnel and patients?
I think, Mpho, let's hope that this was an isolated incident, one of very few, and this doesn't become a norm, because the public has a right to go to a hospital and expect to be safe. We know we've got a lot of crime in our society, but we should really hope that hospitals and healthcare facilities don't need to be victims of this as well. And also, we need it to be, there is high security at most healthcare facilities anyway, but we need it to be accessible for patients. And remembering, women with young children go to hospitals, babies and small children go to hospitals and to clinics, and they don't need to be feeling under threat. So I think there's a lot we need. The police can help a lot, but there's also a lot that maybe hospital and healthcare managers can do to negotiate and discuss with their communities about how to keep hospitals safe in the community.
The other issue that's also come to the forefront is an increase in violence against the staff internally, doctors, nurses, paramedics, patients becoming an occupational hazard at government hospitals and clinics after several reports of staff who've either been punched, bitten, robbed, assaulted or even killed. In Gauteng, officials have announced that they have plans to tackle the security lapses by providing staff with additional training. Is this really a viable solution? Because, some of the staff have spoken to mental health patients attacking them within their workplace.
Yeah, and that, unfortunately, is always a risk. If people are, not all mental health patients are violent by any stretch of the imagination, but there is a risk with certain people who are mentally ill. But with other patients, one shouldn't be expecting to be attacked. And it's unfair to healthcare workers. They're there working long hours to look after people. We know that some of these incidents obviously are due to alcohol, and how we can prevent that, how we can help people to start reducing the intake of alcohol, and the effects on society and hospitals in general. But we can't shut hospitals down. We can't shut clinics down so that people have to ring a bell to get in all the time. There's a reality of how people have to access these services. So I think a lot of work needs to be done by the police, and a lot of work in communities about ensuring that people understand their rights and their responsibilities when they attend a healthcare facility. And also friends and family who may be with the person who's perpetrating such violence, that they take responsibility for trying to keep them under control.
You made the link earlier on quality and safety. How much of a role do systemic and contract management issues play in escalating security concerns in public health facilities?
I think the systemic issues are a factor of patient safety in general. If staff don't have the right equipment, or it's not maintained properly, or they don't have the right training to look after patients safely, then there are issues there. Certainly within contract management of security services, though, that is an issue that the management must make sure that the security contracts are tight enough to ensure, as far as they can, the safety of staff and patients.
As you prepare, Jacqui, before we let you go, to host this safety conference, what sort of outcomes are you expecting to now take to, public institutions, health facilities, as some of the solutions to the escalating problems that we're seeing on a day-to-day?
Well, we hope that the outcome will be that people will learn. We've got a very good attendance already registered. But they will learn from what we've got colleagues from across Africa, from Ghana, from Rwanda, from Kenya and South Africa. So we're hoping that we can share that learning about how people have made quality projects sustainable, and not just been a project, that it's actually endured and is now creating a resilient health system. And that patient safety and staff safety are equally important, that we ensure that the care that we give patients should do them no harm, and that the staff are in a safe environment to deliver that care to the best of their ability and to the highest quality standard in all facilities, public or private, in whichever country they find themselves.
Do you find that there's a common thread on some of the challenges that are being faced perhaps on the continent, and whether or not they may have been exacerbated by socioeconomic factors?
Oh, indeed. I think socioeconomic factors play a large part. I mean, we know we have critical shortages of healthcare workers in the continent. We are losing healthcare workers to the UK, Europe and other places, and to Canada and other places. We've got to try to find ways to keep the staff that we train enough, and that the systems can absorb those staff that we train. Also to ensure that the facilities are properly managed, that the infrastructure is maintained, the equipment is maintained and is adequate for the job that it's meant to do. We have a lot of donations from overseas into some hospitals and in different countries, and often it's not suitable for the country. It might be the wrong voltage. So ensuring that governments and ministries of health can specify what they need to supply their facilities, and that staff are properly trained to use the equipment they have, that everything is maintained, and that we value our healthcare workers. They do an excellent job. We have to treat them with respect and value what they do, and ensure that we look after them to make their working environment a place they want to stay, and that the investment that we make in health is a positive investment. Because if we don't have a healthy population, economically we're going to fail. So health is such an integral part of everyday life, and that we need to make sure that the services that we provide are the very, very best quality to every single patient, wherever they attend a healthcare facility.
How much of an impact do you think healthcare facilities in the country have been dented when it comes to the aftermath of COVID-19 around issues of quality management and patient safety?
Well, actually, I think COVID did us, in some ways, it did not a favor, but it taught us and it showed us how resilient our healthcare workers can be. The team spirit that happened during COVID, and remember, our healthcare workers were under immense pressure. There was a huge fear factor. Some of them weren't even allowed to go home because families and friends didn't want them near them because of fear of the disease. And yet we saw some of the most innovative practice during COVID. I think we should give a huge round of applause to our healthcare workers because they did such an amazing job. And we're still learning lessons and reflecting on what we learned from COVID, sort of how to be more adaptive. I remember one hospital was saying their patients weren't able to eat. They didn't feel an appetite. So they introduced smoothies into the menu. Innovations like that, very small, but very important to make patients be able to get better by having good nutrition. And the infection prevention and control, the use of standards. We have a number of accredited hospitals who said that having the standards actually helped them to maintain the systems that allow them to deliver good services during the period of COVID and subsequently.
Yeah, very well. Thank you so much for weighing in on this discussion. The 11th Quality Management and Patient Safety Conference, of course, set to discuss some of those key issues. Jacqui Stewart there, who will chair the conference, talking to us about some of the challenges and solutions they're hoping to get out of this conference.